Bring our guest speaker, Dr. Bhanu Chander sir completed BHMS from Dev Homeopathic Medical College and MD Organon of Medicine from Guru Mistry Homeopathic Medical College, practicing as a consultant homeopathic physician at Sahasra Homeopathic Clinic in Hyderabad. Attending Swara Homeopathic Gurukul since 2017 and completed teacher training course in Swara Gurukul under guidance of Dr. Sekhar Algundik sir. In previous session, sir discussed about practical importance of organon, repertory, and homeopathic materia medica. And today, sir discussed about understanding the materia medica of Loganiaceae family. So, without further delay, I invite you all to join me in extending warm welcome to Dr. Bhanu Chander sir. Thank you. Welcome, sir.
Thank you, ma'am. Thank you for your introduction.
Bhanu, make it full screen.
Yes, ma'am.
Now it is full screen.
Okay. Hello. Is it audible, ma'am?
Yes.
Thank you, ma'am. So, good morning to one and all. And it is a one more session for me. And I hope everyone is going through all the sessions and all the sessions are informative and interactive. So today with the new session, so first of all, it is conducted by the Vidhyadeep University, Vidhyadeep Homeopathic Medical College in collaboration with the Swara Homeo Gurukul. So my sincere gratitude to Dr. Shekhar Algungi sir from Swara Homeo Gurukul and Dr. Vipul Shastri sir, Principal of Vidhyadeep Homeopathic Medical College, and college management also for these wonderful sessions. So let us go into my topic. So my topic is understanding the materia medica of Loganiaceae family. Before entering into the topic, so I want to ask a question. Anytime did you ever thought, even though knowing the cause of the disease, a patient is not improving or not getting the cure? What may be the reason? Most of the time, the cause, we can find the cause of the disease. On that, we can prescribe the remedy, but it is not working. Why? Patient is not improving. Why? You can answer in chat box. Really, you are going to learn new things today. No reply, no answer. That means on the cause, everyone is getting cure results or patient is improving. Let us go further. Why? Because even though we know the cause, maybe miasmatic block or things of lifestyle which is hampering the cure. Yes, correct. This is one of the reason. Thank you, sir. Yes. Reason is that even though we know the cause of the disease, but we are not getting improvement because every individual has some patterns. That pattern we have to understand. That is nothing but the constitution. Not only on the cause we cannot prescribe. We have to understand the person as a whole. Every person has a certain patterns, what we call as a constitution. We have to understand that constitution. How can we know that what is his pattern? So every person sees, perceives the things with his senses, and he perceives and he reacts because of this perception and reaction. Like Newton's third law, there is for every action there is a equal and opposite reaction. So this law cannot be changed. In the same manner, in our body, our senses receives the information and react or response to the stimuli. That is where health and disease comes into play. So it's all about the inner patterns. It is all about the inner experience. After receiving the stimulus, how we are experiencing that thing and how we are reacting. This is a pattern. With this pattern, they exhibit the symptoms, signs and symptoms. So it is purely a patterns of inner sensation. So to understand the remedy in easier way, if we understand this pattern in the form of kingdom wise, it is very easy. Even though there is a different remedies have different patterns, when we comes into a group study, then it is very easy. So plant kingdom has certain patterns, mineral kingdom has certain patterns, and animal kingdoms have certain patterns. In that also, every remedy has their own individual patterns. I hope you have understood. So in plant kingdom, we see plants are rooted to the soil, and the only way they can grow and flourish are by being sensitive to environment. Plants are sensitive to environment. And since the environment is constantly changing, they need to keep adapting. So in nature, if we see the plants, they are sensitive. They always adjust to the climatic conditions. In the same way, if we uh, compare with the patient from the plant family, he is also a sensitive person and he reacts, he adjusts with the environment. So that's very important that adapting things we see in the plant remedies. They adapt to the situation. When they are not able to adapt, they get the diseases. This sensitivity is expressed as a specific sensation and reaction. That is, every plant remedy has its own sensation and reactions. So when they get the disease, when they are healthy, they won't give any sensation, abnormal sensations or reactions. But when they get disease, they give particular sensations and reaction, which are coming from the constitution, vital force, which are coming from the pattern. So plant temperament represents the struggle between rapid changing emotions and the mental control. So during this phase of adjustment or the adapting, there is a many change of emotions we see in the plant patient. They want to control their emotion, not the external situations. Whereas in animal kingdom, they try to control external situation or the surroundings. But in plant, uh, they are feeling problem with themselves only. Because of that, there is a struggle between emotional changes and the mental control. So what is sensation? What is sensation? Sensation is how they perceive, feel, or experience. This becomes sensation of particular individual. The effects of emotional and physical trauma becomes its sensation. The plant remedies feel things very deeply and they suffer when their emotions are ignored or repressed. Their emotions are very deep. Plant remedies emotions are very deep. They easily go into emotional state, emotional disturbances, easily get affected by emotional disturbances. So certain families have certain types of sensation. Like for example, if you see the Anacardiaceae family, there is a sensation of caught, stiff, tight, tension, stuck, shock, this type of sensation. If you see uh, Ranunculaceae family, shock, hurt, insult, this type of sensation we see. I hope everyone is understanding. Is it clear? Is it clear? Please response. Yeah, thank you. So this is about the sensation. We learned about the sensation and reaction. In that we have seen the sensation. What is sensation? So what is reactions? Generally, there are two types of reactions. They are active reaction and the passive reactions. So survival of the plant depends on the how they react to the external stimuli. So that is where we talked about the adaptation and adjusting to the external environment. In the same way, plant survival depends upon the how they respond, how they react to the external stimuli. In patient language, they will react mentally and physically in the form of symptoms, signs and symptoms. Some will be anger, some will be passively they are weeping, crying. Some will show the symptoms like trembling, shivering. Some will hit to the opposite person. This is about the reaction. So active reaction is what he does. Actively what he is doing after receiving that stimulus becomes an active reaction. And the passive reaction is what happens to him after receiving that stimuli, what is happening to him. It becomes a passive reaction. So in this sensation and reaction, patient sometimes he may give reactions, he may not give reactions. He adapts in the form of compensations, where he lives with this sensation and the reactions. It is nothing but the compensation. The compensation is how he lives this life despite the sensation and the reaction. It also represents a kind of long-term adjustment that the patient makes in order to live with that sensation. For example, if patient is suffering with some emotional things, initial phase of that situation or the life, he will react to that situation. He will respond to that situation. After certain time, he doesn't react to that situation. Just he live like that, where he go into the state of compensation. Especially we see in the long emotional things when the patient is affected deeply, chronic emotions. In that cases, we see this compensation. So to get some idea about this, it is especially when we are dealing the person in sensation method, we see the cases in the form of this sensation, especially the plant kingdom remedies, in the form of sensation, reaction, and compensation. So to get some idea, even though you are the internship students, but to get some idea. So these things also exist. So to understand the remedy holistically, we have to know what all things are going in homeopathic practice. So brief explanation about these things later. The question still remain unanswered. Why different remedies in a family have such a wide range of difference in their symptomology? So now we have seen that certain kingdoms, certain families have certain patterns so that we can understand this person may belongs to this kingdom or among that kingdom, from that kingdom, this family. But in family, there are n number of remedies. In every family has at least there is a 8 to 10 remedies. How can we differentiate? If anyone has the idea, they can share. How can we differentiate? Now we know the family. This person is belongs to this family. In that family, there are n number of remedies. Among that remedy, how we can choose the this remedy suiting to this person. If anyone has idea about this, they can answer it. How can choose? How can we choose among that? Okay. This could be explained due to the difference in the miasms. Sensation is a common in a family, but each remedy experience that sensation. Reaction on physical and mental aspects is different. Right, sir? Exactly right. So this reaction, what you have said, correct, sir? This reaction, especially because of the miasm. That's what. Each remedy experience that sensation with a different degree of depth and degree of desperation. So this sensation, whatever the stimuli they are taking, that is experienced by different remedies with different degree and depth of desperation. That is, according to their miasmatic background, they experience that sensation. If they are coming with a psoric background, if they are coming with a psychotic background, or if they are coming with a syphilitic miasm, so their symptoms will differ. Because of this miasm, their receiving and producing of symptoms differs. So miasm is very important. So sensation, passive reaction, active reaction, and compensation together defines, conforms, and differentiate one family from the other. So in a healthy state, mind, body, emotions or different areas show same experience at the same time. Easily patient constitution is seen. In healthy state, the patient is mind, body, emotions, and everything shows the same thing. That energy is equally distributed in this healthy state of a person. That is, constitution is healthy. Energy is vital force is distributed equally, energetic, active. When there is a diseased state, this energy is disturbed. This energy is accumulated or decreased or disturbed. Because of this disturbance, they cause the symptom, they cause the disease. In this way, we can see the disease and healthy state. In this way, we can understand the health and the disease. In this way, we can understand the plant. So I hope before going further, I hope it is clear, understandable. Is it clear, sir? So now we have seen that sensation, reaction, and compensation. So in Loganiaceae family, what are the sensations? What are the reactions? What is a compensation? In Loganiaceae family, there is a sensation of shock, shattered, torn to pieces. Shock is sudden, disappointment, ruined. This type of sensation we see. They see the stimulus as a shock. They see the stimulus as a sudden. The disappointment which they are experiencing is which is sudden, which is very strong. And their reactions would be paralyzed. After receiving that stimuli, their reaction, their body shows, their mentally, physically, I cannot move. Sadness, cannot weep, grief, silent, faint. This is all about passive reaction. And the active reaction of Loganiaceae beside oneself. They want support. They try to hold someone. Excitable, convulsions. Most of the symptoms we see the clinging nature in this family. They try to hold. Compensation is composed and calm. So this is the sensation, reaction, and compensation of the Loganiaceae family. So let us see. So in this family, remedies produce mainly two types of actions. They are hyperreflexia and secondly, there is a exertion and paralysis. First, they shows the hyperactivities. They are oversensitive, irritable, hysteric symptoms, destructiveness, convulsions, neuralgic symptoms, pain, trembling. This type of symptoms they show initially. After that phase, they shows exertions, paralysis, weakness. This type of symptoms we see in this family. So there are active principles. So plants majorly they work on, they produce symptoms on the basis of alkaloids. Because of that alkaloids, they produces the symptoms. If you see in every plant family, every plant has alkaloids. That alkaloids are the thing which produces the symptoms in that remedy or the drug. So in this family, we majorly see these three type of alkaloids, which are the active principles. Active principles are gelsemium, strychnine, and curare. This gelsemium acts as a mediatoric effect, where we see these things in the dilatation and contraction of the pupils. Whereas the strychnine, it acts as a very poisonous alkaloid of this family. It shows the restlessness. It acts on the nerves and the muscles. It paralyzes the muscles. Patient restlessness, trembling, numbness, which we see in this strychnine. And Curare is this active principle acts on end organs. It destroys the end organs. Especially it shows its action upon the end organs. Example in BP, high BPs. We take this, it dilates the blood pressure, blood vessels. It decreases the blood pressure, and it also acts on a respiration, and it causes a respiratory paralysis. And it also acts on the intestines. It causes the motility, increase the motility of the intestinal peristalsis. Intestinal motility. It increases the intestinal motility. So these are the active principles of these families and their actions. So common general characteristics are these remedies, this family constitution, most of the remedies has pale, anemic, black hair with black skin. Their temperaments are nervous, irritable, hysterical people with sedentary habits. Miasm most of the time is Sora, predominant, and it has all the miasm, but predominant is Sora. So diathesis is rheumatic and goitic. Thermal status is chilly patient, most of them. Sphere of actions when comes to mucous membrane, attacks on mucous membrane, nervous system, GI tract, urogenital organs, especially the organs which have rich in muscular and nerve supply. These remedies acts on that cardiovascular system, motor sensor system, brain and mind. So characteristic mental symptoms of this family is these remedies are hypersensitive, emotionally excitable. They're hypersensitive, they easily react to external stimuli like noises, sounds, dust, anything, external stimuli, light. They are hypersensitive, oversensitive to this external stimulus. Emotional excitability and mental irritability we see. So any emotional exciting things, if any slight disturbance in their emotion, their state changes. They get irritated. They mentally get irritated. In this way, we can see these emotional disturbances. They always want to be left, want to be alone. They want to be left alone. Doesn't want to speak. And brooding on the past things. Suicidal thoughts we see in these remedies. Nervousness. We see most of the anxieties and anticipation in these remedies, where anticipation, ailments from anticipations, anticipation in appearing in public places, interviews, exams, this nervousness we can see. Fearfulness, shaking, numbness, this type of things we can see. Easily angered, intolerability to contradiction. This remedy shows anger things, anger on contradiction, anger when obliged to answer. Depending upon the miasm, this anger issues differs. So hysterical manifestations we can see, and globus hystericus, where most of the remedies from this family have this symptom of globus hystericus. There is a ball-like sensation at the cardiac end of the stomach. There is a all-gone sensation, ball-like sensations we can see. So they are oversensitive. In Nux-Vomica, if we see this oversensitiveness, they are impressionable, sensitive to all external impressions, cannot bear odors, noise, light, air, etc. Even the slightest words can offend them in Nux-Vomica. How oversensitive they are. In Spigelia, very sensitive to the parts touched, feels chilly, sends shudder throughout the body. So nerves get affected here, very sensitive. Gelsemium, if you see in Gelsemium, they are very sensitive to external impressions and excitements. Emotionally, this Gelsemium is very sensitive. They easily get fright, easily get anxieties, easily get shocks. This type of things we can see. In Upas, there is an increased sensitiveness to the cold. Slightest weather change also they get the cold. Hyperesthesia of all senses in Ignatia. When we come to depression of mind and great irritability, when we see in the Nux-Vomica, there is hypochondriac. These are the people who are oversensitive and hypochondriacal. They have the suicidal thoughts, but is afraid to die because this Nux-Vomica comes from the typhoid miasm where there is a soric tinge is present. Because of this Sora, they have that hope. Even though they have the suicidal thoughts, they won't suicide because of this hopeful situation, hopeful thing. And they are malicious disposition, quarrelsome, even to violence. Extreme, where we see in the Gelsemium, extreme nervous and irritability. Every exciting news causes diarrhea. So, diarrhea on anticipation, diarrhea on emotional disturbances. They want to be desired to be alone, doesn't want to be spoke. When we see Curare, depression with inability to think or study. Very indolent and sleepy patient desire to be let alone. In Ignatia, we know in depressions or the emotional disturbances, we most of the time we prescribe this Ignatia. So these people have hysterical temperament. There is a lot of changeability, changeable dispositions. There is a mood changes, alternation of the foolish and tearful mode, sadness, happiness, foolishness, sadness. We see alternation of the moods. So these remedies have paralytic action also. Where when we see these things in Gelsemium, for example, acts on the anterior column of spinal cord, producing the muscular paralysis. We see extreme weakness and extreme muscular weakness, prostration, especially out of this all the remedies, we see most of the weakness in these Gelsemium patients. Paralysis of the muscles of different parts of the body causing, if they are affecting the eyes, it causes the ptosis, strabismus of the muscles. If they are around the mouth, there is a deviation of the mouth. In larynx, there is a hoarseness of voice. In the extremities, when it is affecting the extremities, there ataxia. There is ataxia, locomotory ataxia we see. In Curare, it produces the motor nerve paralysis, but sensations are spared. So paralysis of extremities with numbness, tingling, and leaden heaviness. Numbness, tingling sensation, and heaviness we see in this Curare. In Spigelia, acronarcotic producing numbness of the hands and the feet. and spin from the warm affections. In Spigelia, we see warm infestations. So when it comes to spasmodic affection, in Nux-Vomica, there is a excitability of whole nervous system we see, with great oversensitiveness to all external impressions. Every distressing emotions brings recurrent epileptic fits. Every emotion causes them convulsions, epileptic fits. We see spasm with tetanic rigidity of nearly all muscles of body. We see in Nux-Vomica there is a opisthotonous condition. In between the attack, there is a muscular relaxation. That's why we prescribe in this is very helpful remedy in paralytic conditions, paralysis. In Gelsemium, if we see this spasmodic affection in Gelsemium, convulsions occurring in children's, young people with nervous excitability nature. In Curare, there is a epilepsy, catalepsy, there is a immobility with fixed gaze on waking. If you see the Ignatia, there is a hysterical spasms and convulsions, especially after fright, grief, disappointment. And there is a epileptic convulsions with foam at mouth, face red or alternatively pale and red. In this way, we can understand the spasmodic affections of this family. So nerves, muscles are affected. Most of the remedies have these physical things is associated with the mental emotions. So triggering of the mental emotion causes this spasmodic affections. So neuralgic pain. So nerves are affecting. So we obviously see the neuralgic things, neuralgic symptoms. In Gelsemium, there is a orbital neuralgia in distinct paroxysms with intense pain over the right eye, bruised feeling in the eyes, dim vision with diplopia, and ptosis and aversion to light. In Nux-Vomica, there is an infraorbital neuralgia with watering of eyes, orbital twitching, aggravated in morning and ameliorated lying in bed. So these remedies are very, in every remedy we see that it is very prominently acting on the eye symptoms, especially the nerves, optic nerve. When I was in the internship, I am going to the some of my sirs. There was one case how these emotional things, how it intensively affect the eyes is that patient came with the complaint that they lost the sight. Patient lost the sight after hearing that. The situation was there was a cancer of her friend, patient and her friend. Her friend mother has detected with the cancer. After hearing that news, she's a very close friend. After hearing that news, she lost that sight temporarily. So when the sir has taken the case, after taking the case, we got with the remedy of Nux-Vomica. So after giving the Nux-Vomica, that sight which has lost, it has came back. So such an intensified effect will it shows on the eyes. So if you see in the Spigelia, it is very important remedy. Facial neuralgic, especially the left-sided, involving the eye, zygoma, cheeks, teeth, temple, cannot bear slightest touch or movement. with shining swelling of the affected side, aggravated from morning until the sunset, aggravated from motion, noise, stepping, etc. We see ciliar neuralgia involving the left eye. Eye feel too large with severe pressing pain on turning them. So even the slightest motion cause them neuralgic pain. The pain is very intensified that the nerve which is supplying all the organs, it affects. Total left side of the face will affect in this Spigelia. Eyes, ears, head, and this cheeks, everything affect. That much intensified neuralgic effect. So generally, common aggravation we see in these remedies are they are aggravated from tobaccos. So when we see in Nux-Vomica, they get gastric disturbances from smoking. Smoking after that. Gelsemium, after smoking, they get headache. After that smell of smoking also, they get that headache. Ignatia, in any form, they get aggravated. Tobacco in any form, they will get aggravated. Coffee, there is a gastric disturbances we can see in Nux-Vomica, Ignatia, many, in all the remedies, gastric disturbance we mostly see after the coffee. Summer sessions, we see the headaches, especially all the headaches have this ailments from exposure to sun. Change of weather, slightest change in the weather or the cold atmosphere or the cold things, they get affected. That much oversensitive they are. They are that much hypersensitive they are. So this is about the general understanding of the this family remedies. So is it clear? Is it understandable or is it fast, slow? Okay, now let us see the individual remedies, how we can correlate, how we can see these symptoms in this. So Nux-Vomica. Nux-Vomica is a poison nut, Strychnos Nux-Vomica. So Nux-Vomica is a hard, ambitious, impatient. Nux-Vomica is very ambitious. He want to do the things by hook or crook. And with that hope that because Nux-Vomica has that hope, he will complete that work. That's why he does the work continuously. Ambitious and irritable, passionate, and very fastidious. Nux-Vomica is very ambitious, very passionate, and very fastidious. If they are workaholic, they do very industrious. They want to complete the work where we see that fastidiousness. They are competitive. The things are not getting in time, or if the things are not completing, then they will get the irritation, where we see the anger with irritable, anger when obliged to answer, anger and contradiction. They are expressive and impulsive. They are outbursting. Nux-Vomica patients are outbursting. They easily shows their irritability and they are audacious and obstinate. General indications are after drugging, coffee, stimulants, tobacco, high spicy food, continued mental exertion. It very well works in the after drugging, after antibiotics, after syrups, especially in the child cases. After nowadays, they are habituated. Parents are very habituated for this. If child is getting any cold, cough, or the fever, they keep one antibiotic or the syrups or like these drugs. So they are coming with these symptoms like running nose, frequently fevers, frequent running nose, cold cough. In my experience, most of the children's, if I see the history of over drugging of medicines, then I prescribe first one dose of Nux-Vomica. For my surprise, half of the child will cure with Nux-Vomica itself. So this is very important. So half of the children are curing with this Nux-Vomica. So later, if person is not curing after Nux-Vomica, after that drug effect is decreased, then again taking the case and prescribing the constitution remedies. So stimulants, tobacco, high spicy food, continued mental exertion. In this condition, we can prescribe this Nux-Vomica. The sedentary lifestyle, especially in uh, business anxieties or the office works, where they sit for long time and they work. The stress, mental stress, business stress. In these conditions, we can give this Nux-Vomica. They are sensitive to the external impressions, noise, light, orders, very irritable and easily offended. These persons are easily offended. So when we see the eye symptoms, we see the photophobia much worse in the morning. Headache, frontal headache with desire to press the head against something. Headache in sunshine. Toxic headache after drugging, after alcohol, after taking the stimulants. If they are getting headache, then we can prescribe this. Hangover headaches after having a drink, if they are having that headache, then we can prescribe this Nux-Vomica. Nose also, there is a stuffy cold. Snuffles after exposure to dry and cold atmosphere. Sudden fluent coryza after raising. Violent sneezing. So that's what. When their immunity is decreased, especially in the children's, because of this drugging, when their immunity is decreased, they shows first reaction is either they will get fever or they will get respiratory complaints like cold, running nose, or the sneezings. These all are the defense mechanism. So it works very well. Stomach. In stomach complaint, disorders of stomach from debauchery, like mental labor, business anxieties, sedentary habits, night watching, and indigestion. From these things, they cause the indigestion. In that condition, we can prescribe. We see nausea and vomiting every morning. In pregnancy, in first trimester, there we can see in pregnant lady, we can prescribe Nux-Vomica. We see with this depression of spirits, nausea better if he can vomit, wants to vomit but cannot. So vomiting of, if they vomit also, vomiting of oily greasy substance we can see. There is a motion sickness from riding in cars and seasickness. So in seasickness or car riding, traveling sickness, we can prescribe Nux-Vomica. In rectal complaints, we can prescribe it in constipation with frequent ineffectual urging or passing but small quantities at each attempt. alternate constipation and diarrhea after abuse of purgatives. After abuse of purgatives. So in bladder complaints, we can see that bladder is affecting, especially the splinter is affecting, where we can see paralysis of bladder, where involuntary of urination when laughing, coughing, sneezing, we can see. So spasmodic effects of bladder due to overuse of stimulants. In female complaints, the menses are irregular, too early, too long, prolonged. Menses with black blood. Dysmenorrhea, prolapse of uterus from straining or lifting, where the muscles are affecting. Male, premature ejaculation, bad effects of onanism, sexual excess after masturbation. Impotence, penis becomes relaxed during sex. In this condition, we can prescribe. In this aggravations are on mental exertion in the morning after eating, touch spicy stimulants, dry weather and the cold. Ameliorated from in the evening while at rest in damp wet weather. Strong pressures. So this is about Nux-Vomica. We come to Ignatia. So it comes with a background of cancer miasm. So in Ignatia, we see that cancer type of like controlling type of thing. With this controlling understanding, with this miasm of cancer, we see most of the symptoms. So they are mild, gentle, yielding, and introverted. They are introverted. They don't share anything with anyone. So they keep everything with them only because they want to maintain this harmony among the harmony surrounding them. They want to maintain that harmony with these controlled emotions. If that harmony is disturbed, if that control is disturbed, then they will get that symptoms. So that's why we see that controlled emotion in Ignatia. And they do all the works. Especially in family, they want to control the family environment. They want to control that family environment. They look after everyone, each and everyone in the family. From their breakfast to their all the things. Because she doesn't want to disturb that environment, that harmonious condition. That's why they are idealistic, sentimental, romantic, and sympathetic for others. Sympathetic for others, caring for others. They support, they don't seek direct support. They indirectly show by caring. Indirectly, they care for others so that they can show that emotions, that emotional support to this Ignatia remedy, Ignatia patient. When that reciprocation is not happening, then they will get affected. Then that control nature is gone. Then they will show that symptoms. So generally we see the ailments from grief, emotional shocks, disappointment. From that expectation, when they are not getting the things, then they get disappointment. From the bad news, embarrassment. Words from consolation. They doesn't want to console. Desire to be alone. They want to be quiet, alone. Doesn't want to be spoken. So oversensitive and nervous. They are oversensitive to external stimulus. Intolerance of contradiction and reprimands. They get anger. Duty conscious. They are very duty conscious because of there is a sense of neglected duty in them. Because of this sense of neglected duty, they work continuously. They work continuously, they care for everyone, they maintain that harmony. In this way, their mental symptoms, we can say there is an internal conflict. There is a changeability of the mood, we can say. Joking, laughter to sadness, weeping, in this way. Spasm, insanity, and epilepsy after grief and the fright. So most of the conditions where we see the paralytic patients after the strong emotional effect, or the strong emotional situations like death of near and dear, like strongly the emotions, deep emotions. If they are getting with the epilepsy, then we can prescribe this Ignatia. So generally in head complaints, nervous headaches, in hysterical movements, we can prescribe. There is a congestive headache followed by anger or grief. Headache worse from smoking or smelling tobacco. We see this complaint, aggravation from smoking tobacco, we can think of remedies from Loganiaceae family. Headache as if nail were driven out through the side, as if the needle were pushed through over right eye into the brain. Headache from abuse of snuffs, tobacco, smoking, alcohol, coffee. In nose complaints, there is a fluent coryza, stoppage of one nostril, dry coryza with dull headache, we can see. In throat complaints, there is a hysterical spasm of the throat. There is a spasm of the throat. There is a difficulty in swallowing, we can see. There is a globus hystericus. Sensation as if lump in the throat. They cannot be swallowed easily. In teeth complaints, we can see Ignatia is very good remedy in teeth complaints, in toothache, especially during dentition. We see soreness in all teeth. Stomach ache. In stomach complaint, there is a sinking feeling in the stomach. There is a globus hystericus. And this is relieved by taking the deep breath, all gone sensation in the stomach, much flatulence we see, and there is a dyspepsia with a great nervous prostration. Nausea and vomiting, better indigestible things. After vomiting of bile and mucus we see. In rectal complaints, constipation with constant ineffectual urging to stool. Diarrhea alternating with constipation. Diarrhea from fruits, fright, emotional excitement, grief. Because of that loss of control over the muscles, over the splinters. When they lose that emotional control, they also lose that physical. Bodily shows that relaxation of their muscular things. Hemorrhoids, better sitting, worst coughing. Sleep, insomnia from grief, worries. Sleeplessness from business failures, depressed emotions, anxious thoughts. Aggravation in the morning, open air, after meals, coffee, smoking, liquids, external warmth. Amelioration from while eating, change of positions. So this is about Ignatia. So when we comes to Spigelia, it is coming from the malarial miasm. So these are the new added miasms. When we are dealing with sensation method, we see these miasms. Some extra added miasms are there. Apart from SORA, psychosis, syphilis, acute, tubercular, we have extra miasms. And they have their own individual explanations. The remedy is well known for the neuralgic and worm infestations. So it has a feeling when it comes to the malarial background, it has a feeling that stuck in position where from time to time is shocked, shattered, disappointed, or torn to pieces. Acts upon the heart and nerves. So it acts upon the heart and nerves where we see the rheumatic and cardiac affections and nervous affections also. There is a mental exertion and the weak memories. And there is a mental exertion. They cannot even think. There is an absence of ideas we can see. Very dull, this person. There is a weak memories. There is a confusion on stopping. When the flow is stopped, they get confused. They cannot recollect the things. There is a stammering we see. Repeats first syllable 3 to 4 times. Agitation and anxiety with restlessness. They cannot sit at one place. They constantly want to move. They constantly want to run. Even the thinking of they can't even think of the pain also. Delusion about pins. They are afraid of sharp and pointed pins. This constitution is adapted to anemic, debilitated, rheumatic subjects. Children afflicted with worms and ascarides, worm infestations, especially in children, it can be prescribed. Causation is concussions, worms, sunlight, tobacco. Phase, prostopalgia, involves eyes, zygoma, cheeks, teeth, temples, worse from touch, stooping from morning until the sunset, drinking tea, suddenly going and coming. So Spigelia, most of the time, what we see is this face complaints, this eye complaints, this headache will come combinedly because the nerve is affecting. This nerve will affect this all the organs, very intensified. And there is a eye symptoms like pressing pain on turning the eyes, severe pain in and around the eyes, extending deep into sockets, worse thinking of them, ciliar neuralgia, neuritis, profuse lacrimation, eyes red, sore, drawing, aching, difficulty in raising the eyelids, with painful si- sensation of stiffness and photophobia. This patient typically shows like this. They will hold like this only. They will hold like this and sit calmly. They will not move even because if they see the light, this complaint of eye, headache, and this pain in the face increases. This pressure makes them amelioration. They see if they remove this hand, this they want to see the light and they want to rotate their eyeballs. This will cause them aggravation and slightest air also. Slightest air, draft of air can also cause the pain. This pain is sudden, intensified. Even they tie this cloth around the head and they will sit like this only. They won't disturb anyone. And there is a eye redness and there is a lacrimation. Along with these symptoms, the lacrimation is there. And this eyeball is very affected. There is a dragging type of pain in the eyeball. These orbits are painful. So head feels large, migraines, pain from beneath the frontal eminence and extending to the eyes. So whenever you see the spigelia, If you see these three organs, these three things are affecting, you simply blindly give the Spigelia. It will work because I have seen the patient, the ditto like this symptom only there as it is. So semilateral involving the left eye, pain violent, throbbing, worst making the false step. Pain as if band around the head. Pain from left occiput to over left eye. Worst from stooping. They even don't even they won't even bend the head also. That if they bend the head, they will get that aggravation. They get headache. If that they get headache, they will affect the eye. They will affect the face. It is a combo pack. Supraorbital neuralgia we see. In heart complaints also, there is a violent sticking or the compressive pain. There is a radiating to throat, arms, scapula. Worse from least motion, bending double. Soreness and the cracking in the region of the heart. We see the angina pectoris, which is relieved by the hot water. They see the craving for hot water, which relieves that. There is a neuralgic extending to the arms and both the arms. Violent palpitation, which are audible. When we are checking the patient, we can hear that palpitations. Stomach complaints, pressure in stomach, accumulation of mucus in the stomach, the sore raising, sore belchings we can see. There is a nausea with sensation of warm rising in throat. There is a back there we see the stiffness, pain in the right temple, a pain from left shoulder to the neck, cutting about the left scapula. There is aggravation from the touch, motion, noise, and turning, washing or concussions. Amelioration from lying on right side with head high. Inspiration. So this is about the Spigelia. So if you see the Curare, this is one of the remedy from this family. It comes with the leprous miasm background. So leprous miasm background, it has with the feeling of intensively shocked, shattered, disappointed from being abandoned by his own relatives, like leprous understanding, abandoned. After that abandonment, they feel that shock, shattered, disappointedness. This situation is ongoing, hopeless. They see hopelessness in everything, desperate, hopeless, desperate, and distinguishing. The rubrics which covers this remedy are company aversion to, aggravation, avoids the sight of people or shuts herself up. Delusion, dirty, everything is. That leprous understanding we can see in these rubrics. Delusion, foul, everything appears. Delusion, great prostration is seen. Destructiveness, kill desire to. It is a muscular poison causing the paralysis of muscles, with impairing the sensations and consciousness. Mind, indecisions, no longer wishes to think or act for herself. Inability to think or study. Forgetfulness, stupid, sleepy, indolent, hurried feeling, depressed and desired to be alone. We see the back symptom, we see the stiffness in the neck, head drawn backwards, stiffness of muscles, or right neck, shoulder, dull, tired, ache in the shoulders or across the back, chills running up, back, and all over the body. So this is about the mind and the back symptoms of Curare. In chest, we see the soreness, sore to the pressure or touch. In limbs, we see the paralysis of the limbs, aching in all the limbs and body. Numbness and tingling sensations we see. Debility, we also see. Lungs, there is a severe pain in lungs, especially left, shortness of breath. So this causes a paralysis of the respiratory centers. If that is happened, then the patient will die. There is a threatened paralysis of the respiration on falling asleep. So after sleep, they see the patient experience that uh, there is a tightness in chest, there is a shortness of breath. They suddenly get up from the sleep. This type of things we can see. Very distressing dyspnea. The rectum, extreme watery diarrhea, diarrhea with constant urging, fetid, thin, much like feces. Excessive pain in hemorrhoids. Skin, we see the leprosy. In leprosy, we can prescribe this. Dirty looking skin, eczema, liver spots. Tubercles on the nose, blood oozes through. Aggravation from dampness, cold weather, cold wind, 2 a.m. right-sided. So when we see the another remedy, these are the small remedies, strychnine, so it comes with the background of acute miasm. It has a spasmodic rigidity, keynote of this alkaloid. So there is a tetanic convulsions with the opisthotonous condition we can see. Tetanus, violent jerking, twitching and trembling are the characteristic symptoms of this remedy. Strychnine has following rubrics, which are because this is coming with the background of acute miasm. So they are fear, panic attacks. We see the fear, panic attacks. So rubrics like fear, panic attacks, overpowering. Delusion, phases, ceased, hideous. Fear, injured of being. Fears, fears and anxieties we can see in these remedies. Pain and sensations appearing suddenly and return at intervals. So mind, extreme nervous excitability, painful nervousness. Moaning, sobbing, screaming we can see. There is sudden pains. Irritability, confusion of ideas, and there is a loss of memory. So most of the remedies from this family have this weakness of memory. Throat complaints, there is a dry, contracted feeling of lump, swallowing impossible, burning along, and a spasm of esophagus. Violent itching in the roof of mouth. In head complaints, they are over irritability, restlessness, full and bursting headache with heaviness on the eyes. See, eye complaints we can see. Limbs, cramp like pains, rheumatism with stiff joints, violent jerking and twitching and trembling we can see in this remedy because it is a alkaloid, it shows on the nerves and the muscles. Stomach, there is a constant retching. There is a violent vomiting, we can see nausea of pregnancy. In the back, there is a rigidity of the cervical muscle. Sharp pains in the nape and down the spine. Back stiffness. There is a icy cold sensation down the spine. There is a cold sensation in the spine. Aggravation from the touch, noise, and the motion. Better by lying on the back. So this is about strychnine. One more small remedy is Brucea anti-dysentrica. So the mind complaints of this remedy is, it is also from the acute miasmatic background. Irritability, augmented in the evening, we see the taciturnity and hypochondriasis. Melancholy with indolence and the lassitude. Sad and gloomy on waking in the morning. On the face, we see that itching tetters on the face, followed by peeling of the skin. Headache aggravated by sitting as well as after eating. Shooting in the head, aggravated by walking, especially in the sun, like sun headaches. Heaviness and confusion in the head with sleepiness disappearing in the evening. So, in the morning, most of the remedies have this aggravation in the morning. In the evening, there is a amelioration. So, limbs, we see the cramp like pain in the back of the hand. There is a miliary eruptions on red raised, itching on the back of the hand and on the body. In the stomach complaints, we see this sensation in the stomach as if nothing had been eaten for a long time. This is peculiar symptom. There is a sensation of burning heat in the pit of the stomach. In fevers, we can prescribe this. There is a sweat on walking with shivering, which appears chiefly during rest. Chilly disposition and aversion to open air, shivering and excessive coldness. So one more remedy is Upas Tieute. It comes with the background of ringworm miasm. It produces Upas. It produces the tonic spasms, tetanic and the asphyxia. So large proportion of the symptoms occurred in the, if you take large proportion, symptoms occurred in the head and the eyes. There is a remarkable headache. There is a superficial drawing pain, traverses left temple from before backwards. Seizure at outer angle of the orbit. The part is hard and painful to touch. So there is a pressure in eyes, feeling of foreign body under the eyelids. There is a severe pain in orbits, inflammation of the conjunctiva of the lids. Distorted visions, we can see. In the mind, there is irritability, disinclined for mental work. Dull backache after excessive sex. Causation, sexual excess. In chest, we see the sharp pain throughout right lung towards the liver, stopping the breathing. Eyes, in eyes, we see pain in eyes and orbits with conjunctivitis. In styes, we can prescribe this remedy. Headache, there is a dull headache, deep in brain, and males desire increased with loss of power, impotence. In this condition, we can prescribe this Upas. So this is about the different remedies of this family, individual remedies and their explanation. Now let us see one case. So this is a case of tonsillitis, migraine, and investigation report shows PCOD polyp. There is a polyp in gallbladder and fatty liver. The patient came and started with this thing. In the 12th standard, there was a lump in breast and got operated. In winter, I will get tonsillitis. That is throat pain, fever frequently. I will get tonsils problem. It is aggravated by cold weather, cold drinks, rainy season. Recently, I had typhoid fever. After that, I have lot of weakness and dullness. One day, I feel good, and other day I feel irritation. Doesn't want to do anything. I postpone the work. Mainly I think a lot of mainly I think a lot for every small things, and I weep easily. After my mother incidents, this thinking process increased. They took mother to ICU and said very less chance. It was like a sudden shock and unexpected. It has affected my brain a lot. I have memory loss problem also. I have to read a lot to memorize. If I read a lot, I get headache. I use it to overthink. My body is getting affected by small things. I am increasing my weight gradually. I have nausea feeling a lot during tension. If I have any tension, I get nausea feeling. I have always low BP. So without asking any question, she has started this narration. And I also have painful periods before menstruation. I get tensed and anxiety. I use it. I use Meftal Spaz tablets. I have acidity issue. Slight food change gets me nausea feeling and vomiting. This headache is staying with me all the time. It is continuous type, aggravated in the morning. So I asked more. So I didn't ask any question, just I said more. Then patient, that's it. And continued, I usually take very less water. I have increased water intake. Generally, she don't have thirst, but now after suggestion from the doctors, just she started taking the medicine. If I get stress or tension, then I said, Then patient said, if I get stress or tension, I will get headache. When my father down, I took lot of tension. Before my eyes, he had fallen down. My heartbeat increased and tensed. Next day, I got headache with pain in eyes. I took Dolo 650. It got controlled. If anything happens suddenly, I get headache and pain in eyes. So I cannot open eyes. I don't see light and I have to sleep in dark. I will have nausea feeling. So this is very peculiar. So I asked. So I asked about this. She said that sudden thing. So I asked about how will be that sudden? I feel heaviness in head with dragging and pressing type of pain in the eyes and around the eyes. I cannot see the light. I cannot open my eyes. Stitching type of pain. If I go into sun, it will increase. Or after exposure to sun, I get headache. So exposure to sun or going into sun, it will aggravate or it will produce. So I will cover my head and go out. Tell me one incident which is sudden. So I asked her about the sudden. She said about that complaint. So it is related to mental complaints. Along with the mental complaints, the physical complaints are coming. So I stayed with this question of sudden. So I asked one incident which is sudden. She said, yeah, both mother and father incidents was sudden. Especially my mother incidents was sudden when my mother had accident. So her mother met with accident. At that time she was in hostel. So my mother said she is my brother. Her brother called and said to her that her mother is okay. But one of his relative and said, called her and said, "You are not coming to hospital. Your mother is serious condition. She is in ICU. Doctor said 50-50 chances." In that moment, it was like a sudden shock. For her, after listening that, it is like a sudden shock. And I don't understand what is he is saying, and it was like a blank. Is I am fast or slow? Is it getting what I am saying? Is it understandable or it is fast? Anyone can reply. Okay, sir. Thank you. So these incidents she has said, and that was it's like shock and blank. So I asked, describe this blank. So there was a complete blank. I don't understand what they are saying, and I don't know what to say them. Even in father issue, it was the same. I asked the question mentally and physically, what was the experience? In that blankness, what was the experience I have asked? So she said, physically, their heart increased and numb feeling in hands and the legs. Whenever I get tension, I will have loose motion. When I went and seen my mother, I was shocked. When I opened the door, I was shocked. I cannot imagine my mother in that position. Shocked and just staring at her and weeping a lot by holding the pillar. This is where they take the support of something in that situation without knowing without knowing them. This is a clinging nature. I am unable to move forward in that moment, just sitting there and weeping. In that shock, blankness, with the numbness and increased heart rate and coldness, and with the weeping, she is sitting there and weeping. My hands and legs become cold and numb. It took me a lot of time to come out of that incident. See, that is important. These family remedies have that intensified emotional injury. It takes lot of time. If we take the Ignatia, if we take the Nux-Vomica or Gelsemium, that much intensified emotions they will have. Tell me about tonsillitis. So I asked about the complaint tonsillitis. There is a pain in throat, stitching type of pain after cold drinks, exposure to cold weather. Whenever I get this, it takes 10 days to go. Fever with lots of weakness, bitter taste in mouth, difficulty in swallowing with stitching and burning pain. During weakness, I don't want to do anything. I become very dull. I become very dull. So this is for this tonsillitis, she is taking treatment since 2 years. She using many medicines. She has used many medicines. Do you have any fears? I asked. She said, I have fear during interviews or the exams. In childhood, I used to have anxiety and fear before exams. I will have disturbed sleep before exam. I will say everyone in the family at home to wake me in the morning. If they don't mean I will shout at them. I get anger. Now I am telling tuitions. Now she is telling tuitions to students. If students have exam means I will get anxiety. When they come, I will ask them how they wrote exam, how many questions they have attended, etc. That much anxiety, that much fearfulness for their exams, that anxiety and anticipation they will have. More than their parents, I will get tensed. This is the emotional thing. This is about the fear. So, analysis of the case. The patient came with complaints of tonsillitis, pain in throat, headache, and PCOD. The investigation. So I asked about the PCOD. She said it is not affecting me, sir. Even though I am having the healthy lifestyle, I have when I took the reports, I came across this result, sir. I am not bothered about that. She said. Okay. So investigation report shows PCOD, gallbladder polyp, and fatty liver. The patient is sensitive person, easily get affected, sensitive to external stimuli. Patient is emotionally disturbed. Patient has congestive headache with heaviness and pain in the eyes, which is stitching and dragging type of pain. Patient is suffering with stitching and burning type of pain in throat associated with fever along with weakness and dullness. Patient is thirstless. Patient having anxiety, fear of exams. Patient can't take decisions confidently. She postpones the things. Postpone the things. Patient is confused in taking decisions. Patient also have weakness of memory. Appetite decreased due to fever. Sensation, there is a shock, blank, and which are sudden. And the reaction is numb, coldness, and the weeping. So this is the analysis of the case. So after repertory, we got with the remedies this Gelsemium, belladonna, calcarea, pulsatilla, sulfur, natrum, silesia. So repertorial result shows Gelsemium, belladonna, calcarea carb, pulsatilla, natrum mure, etc. But the remedy selected was Gelsemium 1 m, single dose. So this was the result. So there was in the impression it was grade 1 fatty liver, small gallbladder polyp. There is a PCOD, bilateral polycyst in the ovaries. After the medicine, the fatty liver was not there and there was a no polyp in the gallbladder. And the PCOD is there, but present status of the patient is now she is pregnant. In next month, in first week, she is going to deliver a baby. Now she is pregnant and she is very happy and she is coming, even though she is going to allopathy physician, gynec for consultation, they will take suggestion of me. So that is the important, that builds the confidence. If you give the correct remedy, it builds the confidence on the system and the physician. So this was the result before and after. So now let us see materia medica of Gelsemium. So Gelsemium is a psychotic remedy. Gelsemium has ailments from anticipation and ailments from bad news. The main feeling of Gelsemium is I have to keep my control when going through ordeals, any situation. I have to be able to withstand very difficult trying situations. I have to be able to withstand the shock and bad news without losing my control. So, Gelsemium will avoid all the shock, disappointment, avoids the picking up the phone, avoids the meeting new people, that is anticipation they develop. He will avoid going into an exam. He thinks he will fail. That is nothing but anxiety and anticipation. This is producing a shock. He will avoid going to hospital for the test result. He fears will be bad news. And if such a situation comes, he will get nervous, rushing to the lavatory, where he loses his control in that emotional, that in that fearful situation, that in that anticipatory anticipation, they lose their control. They lose their bowel control. So that's why we see on anticipation, diarrhea on anticipation. This is a kind of neurotic personality, and neurosis in homeopathy is psychosis. So this is a psychotic, it comes with the background of psychotic miasm. The causation is ill effects of fright, depressing emotions, and anger, bad news, unpleasant surprise, shocks, sun, heat, warm rooms, cold, damp weather, alcohol, drugs, and masturbation. So mentally, the patient is dull, dizzy, drowsy, droopy. There is a mental exertion and there is a dull dizziness because he is a weak. We will see that weakness, tiredness, and delicate nature of this remedy. There is a mental exertion. They lose the sense of hope. They create that sense of helplessness, incapacity to think, and the fix the idea. Vanishing of thoughts we can see. They forget the things. When they get this tension, they forget this thought process also. That is blankness. They don't know what happened. For the short time period, they go into confusions. Their memory is lost because of that alkaloid effect. There is a great depression with confusion of mind and exhaustion. There is a desire to be alone, quiet, doesn't want to be spoken, dread of being alone, and there is a fear of falling, stage fright, fear of exams, fear of losing control, self control, and there is a fear that the heart would cease if they won't move. This peculiar symptom we can see in Gelsemium. There is an anxiety and anticipation. Anxiety about future, anxiety about health condition, anxiety about family members, and there is an anticipation. We can see that ailments from anticipation and anticipation when appearing in church or interviews. We see the diarrhea from anticipation. There is a clinging nature we can see. The patient holds either person or non-human things. To controlled in that situation also, they will hold to certain things. That clingy nature we can see. Especially in children's, we can see more. So headache, there will be a dull headache with a influenza. Sensation as a band around the head, occipital headache, dull heavy ache with heaviness of eyelids. Headache worse from the mental exertion, which we can see in our patient. Nervous headache from emotional excitement, headache better pressure, headache better profuse urination, headache with faintness. In the eye complaints, there is a dull, sleepy look of eyes. Heavy drooping of eyelids. There is a ptosis condition we see in this Gelsemium. They hardly opens the eyelids. You can see that congestion in the eyes. Orbital neuralgia with contraction and twitching of muscles, bruised pain, back of orbits. They say clearly something is dragging in the eyes. Something is dragging in the back of the eyes. They say clearly. Exposure to sun or the gaslight, aggravation. So nose, in the nose complaint, we see that acute coryza with dull headache and the fever, coryza with influenza. We see sneezings in the early morning. The throat complaints, throat feels rough, burning, pain from throat to ear. Feeling of painful lump in the throat that cannot be swallowed. Larynx is raw. So it is very raw that they cannot swallow the thing. Food also. Very painful and burning in the throat. There is a back symptoms like backache we can see with occipital pain, backache day before appearance of the menses, dysmenorrhea we can see, chillness up and down in the back, dull aches, heavy pains up and down in the spine, better by walking. In the limbs, we see that deep-seated aching in the limbs, in bones and the joints. They usually, their extremities, like in lower limbs, they will get affected. These calf muscles are majorly affected in Gelsemium. Myalgia from overexertion, loss of power of muscular control. Excessive trembling and weakness of limbs we can see. Numbness and weakness of limbs. Professionally, neurosis, writer's cramp. In writer's cramps, we can prescribe this Gelsemium. In bladder condition also, there is a partial paralysis of the bladder we can see. Frequent urging with the scanty emissions and tenesmus of the bladder, incontinence from paralysis of sphincter, constant dribbling of urine, but not a drop flows on making the greatest effect. Bedwetting in the nervous children at night. Our patient said one symptom that I have not written in this. If she goes outside, she will not urinate. When she come to home, then she gets that urge for urine. That much control over their bladder it will be in their surroundings. She goes out. She said that if I go out, I don't get that urge of going for urine. If I return to home, when I was at the gate itself, the urge increases. In this type, the control will be seen in this remedy. Temperature, chills without thirst along the spine, influenza with chills, muscular soreness, great prostration we can see during the fever condition. There is a chills along the spine, which are wave-like, extended from top to bottom, occipital to sacrum, which are wavy-like, wants to be held because he shakes so much, so much. Fever with drowsiness, fever with thirstlessness, fever with stupor, dizziness, faintness, and weakness. See, one of the peculiar thing is we have to observe in this way also. In the fever, especially in this patient, during fever, she is very weak. During fever, usually we take the antibiotics or the medicines of the allopathy medicines. Here, two things coming in contact. After taking the antibiotics or the allopathy medicine, she is affecting. With this, she is getting weakness. Along in the fever, she is getting weakness. With this, she get very weak. We see the drowsiness, droopiness, dullness, and we see that fever with stupor, dizziness, faintness, and weakness, and aggravation from the damp weather, fog before thunderstorm, and excitement or the emotion from bad news, tobacco smoking. When thinking of his elements, at 10 a.m. So the conditions can be aggravated. General amelioration is bending forward by profuse urination, open air, continued motion or the stimulants. By this, they will get amelioration. So this is about Gelsemium. It is a case of Gelsemium and the materia medica of the Gelsemium. I hope you have understood this remedy Gelsemium. So I have completed this and let us have some recap what we have done. So first we have started with the general introduction and there is a general explanation about the sensation, reaction, how the person is affected in healthy condition and disease condition, how the person is, how we have to see that disease and healthy condition and energy disturbances we have seen, we have understood sensation, reactions, and compensations, and we have gone through with this general understanding of Loganiaceae family with different remedies, how they have common effects on the nerves, muscles, and mostly the mind symptoms, emotionally how they are affected. Later, we went with the individual remedies, Nux-Vomica, Spigelia, and Ignatia, Curare, Upas, Strychnine, Brucea, and later we came with one case of Gelsemium, which is tonsillitis, migraine, and gallbladder polyps, PCOD. And we have seen the materia medica of the Gelsemium. So this is about today's session. And thank you for this opportunity, for giving me this opportunity to share my knowledge. And I very much thankful for Shekhar sir and Vidhyadeep Homeopathic Medical College for giving me this opportunity. If anyone is having any doubts, you can come with the doubts. If anyone is having any doubt, you can come with doubts. So that I hope you all understood the whatever things I have said regarding this Loganiaceae family. Thank you so much. So if there is no doubt, we can wind up the session.
Thank you, sir.
Thank you, madam.